in this module, we're going to be talking about the supports that you can offer a GP. So this is really important. So, I think GP supports in the first instance is really creating a welcoming environment and thinking about the ways that you can include the GP as a team member, because that's what's really unique about working in the Headspace context. So offering them to be paid to attend team meetings if you have a budget that can accommodate that, I think is really important, and also supervision and other supports around risk and their management of young people. Because usually most centres will have a supervision structure for their allied health professionals, so it shouldn't be too hard to just hook the GPs into those. The difficulty might be, can you afford to pay the GP or not for that? I would say that if you can, then that will greatly demonstrate that you value the GP in doing that. So I would encourage you to consider that. Also, the other thing that GPs really love is access to psychiatry. So if you do have psychiatry as part of your centre, then thinking about, can you link your GP into that as part of their sort of supervision model, or it might already be the supervision model that you have in the centre. And then it might be, if you can't directly, about other centres or other ways that you can access psychiatry, so through a telepsychiatry model or other centres nearby offering access, could you link into those? So thinking a little bit bigger than what you're able to provide yourself, so even in terms of that linking with other centres might be an option that you could consider. The other support is training, and we've talked a little bit about that. So it's really important to make your GPs aware that we have accredited training about seeing young people in youth mental health. We also have training available around alcohol and other drugs for young people, and this has been purpose-built and accredited, so it will be greatly assist them in their work in understanding the Headspace model. It's a recent review of the evidence, so making sure your GPs know about the training and encouraging them to do it. And I think for a new GP, I would be encouraging that you're setting an expectation that you think whatever level of experience and comfort they've got in seeing young people, just pointing out, look, it's our recent review of the evidence. We've had really great feedback from other GPs, even if they're really experienced in terms of doing the training. It links to a whole bunch of Headspace and other resources, so it's really, it'll really assist them in the work that they're doing with young people. Other things that you might think about in terms of looking at their training thing is, if they're not familiar with the electronic medical record that you've got on site, then this would be a really valuable investment, paying for the GP to do some training in that EMR, so that they're using all of the systems appropriately, because that'll also impact on quality and safety as well. Other things that you might think about, does the GP, you would think most GPs who be interested in working in a Headspace Centre will have their GP mental health skills training, but if they don't, they can get that through accessing either face-to-face training, but also our training is accredited for that if completed with the core module component as well. And long-term needs, then some GPs might have an interest in better understanding what some of the focused psychological work that happens in a Headspace Centre, and they might have an interest in doing some of that work so that they've got some extra skills in their toolkit that they can use with young people when they're seeing them. So the focused psychological strategies is another training that can support them in staying in their work in Headspace. So there's a really good face-to-face training that's available on the Australian Psychological Medicine Association website, and that will also be linked as a resource on this training. Even though I dodgily looked over towards Rachel at the end.
Should you mention that the GP mental health skills training and the physical sexual health AOD training is linked to this course page as well? Will it be?
It will be.
Yep.
Why don't you just do all of the resources that I've mentioned in this course are linked to on the left.
Very loud.
Oh god. I'm gonna your facial hair, Robbie. Yeah, so all the resources that I've mentioned are linked on this course page. And you're
all of the resources are linked on the home page. All of the resources. Sorry, I have to do that. I'll do that again.
Oh, really?
Well, you may choose to use that one. So they're all available on the training page,
Course page.
on the course,
On this course.
on this course page. Of course, all of the resources that I'm mentioning, including the ones about the training that I've mentioned, are accessible via the course page. I think I've said that correctly.
That's fine. It sounded great. I don't know what your face was doing though. I couldn't look at you.
You said more smiling.
Let's go one more time. Let's go one
Oh,
more
really?
time
Do I have to
just
go
make
again?
sure.
Well, what was I doing wrong then? I'll probably do it again.
It's good to have an extra.
Of course, all of the resources that I've mentioned throughout this module, including about the training, it's available and can be linked to on the course page.
Great. We didn't pick up
It was
right
fun.
time.
It was fun. Okay, let's move on.
Can I get a cup of tea?
Oh yeah, let's have a little break.
Can we have a little break?